Welcome everyone to our question and answer forum for children and young people in out-of-home care. I would like to just introduce the young people who are participating today. So we've got Zara in the northwest, we've got Jubilee in the south, we have Nicola in the south, we have Derek in the north, we have Tara in the north, and we have Jaren in the northwest. We'd also like to thank all of the young people that participated in sending in questions for today's forum, which is really great. And I'd like to hand over to Jaren now.
Hey guys, we'd just like to take a second to remember the elders and Aboriginal peoples that have collectively brought us together in the world wherever we are.
Great, thanks, Jaren. So now I'd like the panelists who are joining us here today to just introduce themselves, please.
Hi, I'm Jones. I'm the Child Advocate for Children in Care.
Hi, I'm Leanne McLean and I'm the Commissioner for Children and Young People.
G'day, I'm Roger Yench. I'm the Minister for Human Services.
And I'm Scott McEwen, the Deputy Director of Public Health. So I'm a public health medical specialist, but I'm also a GP as well. So good to meet you all.
Great, thanks. And Roger, would you like to just address the young people here as well, just briefly?
I would, and I'd like to thank you very much, Danny, for inviting me part of this today, and thank the young people who have given us their time to a chat today on behalf of the other people who are watching and who are interested in their questions and our answers. And I'd also like to acknowledge that although we're on phones, I'd like to acknowledge the traditional owners of the bits of land on which each of us are dialing in from today, and acknowledge elders past, present and emerging as well.
Derek, you've got the first question. Would you like to go with your first question?
The first question we have is, what financial assistance is being given to the carers to help them get through it?
I'd be happy to give you an answer on that one, Derek, and thank you very much for your question and for bringing it forward. And we realise that having young people, whole households at home all the time more is going to cost households money and carers money. Things like, obviously, toilet paper and hand sanitizer and some of the other things that you used to get or buy when you're away from the home that you're now going to need during the day in the home. And so what we've been able to put forward is a payment to each carer family of around $200 per each child or young person who's in care, just to help with those costs of setting up for living at home, self-isolating and maintaining social distance and keeping hands clean and keeping everybody safe. That's just going to go into the household budget to help out with those costs as a first gesture that we can do to make sure that nobody's out of pocket straight away because they're doing the right thing and staying home.
Jaren, you've got the second question, thanks.
Yeah, so who can I go to if I'm uncomfortable with being abused during the lockdown?
That's a really good question, Jaren. It's a very important one. It's really important that we have children and young people knowing who they can go to and that they can stay safe during this time when their contact with people might look a lot different. You always have options of who you can go to, and who you choose to reach out to is usually going to depend on who you probably most feel comfortable with reaching out to and talking with. I would certainly encourage you to reach out to your worker, your child safety officer. If you've got their direct contact details, their phone number, their email address or even their mobile, I would certainly encourage you to do that. You might prefer to reach out to someone else that you know, a support person, a teacher, a friend, and they might be able to contact safety on your behalf.
Great, thanks, Sonia. So Nicola, you've got the second part of that question.
Is there a helpline for children and young people in care that might be having problems at home during this lockdown?
Absolutely. If you're in care and you don't have your workers' direct contact details, the statewide phone number that you can call, which will then direct you to your region's centre, is 1300 737 639. If you are not in care, if you're not involved with the Child Safety Service and yourself or somebody else that you know is not safe and you need to let somebody know, that's the advice and referral line. So that number is 1800 000 123.
Great, thanks, Son. So Tara, you've got question number 3.
Yeah. So my question is, what has been done to encourage access visits during this hard time? Are the kids able to video call or phone whilst being safe and feeling the privacy to do so?
Thank you very much for the question. Access visits are just as important now as ever. They're a critical part of maintaining your networks and your relationships with family and other people. And we will make sure that you continue to have the opportunity of those visits and those other contacts that you need. We just need to do it in different ways, because with the coronavirus out there and because people and contact is the way that it moves around, we just need to work out how to minimise travel and physical contact between people. So we're all working at, just like today for this question and answer session, rather than doing it in a room all together, we're having to use technology, and some are better at it than others. Me, for example. So we're going to have to do less face-to-face, but more other types of keeping in touch, including video conferencing and Skyping and those sort of things. And so it's also important that all of our young people have access to the means to be able to do that, phones and iPads and computers, etc. And because not everybody has their own one of everything, and not every household does, we've established a little communication and technology fund that you, with your carer, if you need it, can apply to for some resources to help you get some more data to be able to purchase a phone, or for your household to be able to set itself up so that people can share a camera, a device, a computer, and some data that ensures that those contacts can continue. So it's a very important part of your life. We will protect it and make sure it can keep on happening, including helping you get access to devices and data if that's what you need to make it happen.
Yeah.
And I'll just chime in there as well. Thank you, Minister. That information around that communication and technology fund has just gone out today to all carers. So it would be really good for any children and young people who know that they have some extra needs around devices or data blocks and that kind of thing. That's the one. Thanks, Roger. Yeah, I've actually just posted that information on the Child Advocate Facebook page as well, which you can find at child.advocate.tas, but it is also being emailed directly to all carers as well. It's a really good time to actually also remind people in care that you have the right to always have safe contact with people that are important to you. You've also got the right to ensure that you have privacy as well in what kind of ways that you might have that contact. If that contact with people is always one that is considered safe, and you would normally be able to do one-on-one or with others where other adults don't listen in, it would be important at this time where you're connecting in other ways that you are still entitled to your privacy as well. And the other thing that's a good chance to remind children and young people is that we would really encourage all children and young people in care to have a say in what the plans and the decisions are around who your safe people are and the people that you want to stay connected to. So being able to have a say about who it is that you want to be connected to, how often you want to be able to connect with them, and what that looks like, what that contact looks like. Really important that you get to have a say in what that is.
Great, thanks, Son. So Zara, you've got question number 4.
Yep. How will school work while we're at home? How will we get the support we need for schooling?
That's a really great question. It's Leanne here, and I'm pretty sure I can answer that one because I've had the same question from lots of young people around the state. So school will continue in term 2, and it'll be pretty similar to what you experienced at the end of term 1. So it's very likely that you'll be at home, but your school will still be your school, your teacher will still be your teacher, and your principal will still be your principal. The difference is that they will connect in with you either online or on the phone or through a learning pack that is actually physically taken to your house. The thing to remember though is that if that's not working for you or your household, that schools are still open and they're safe places for you to be at the moment. And the reason they're still open is because there's 2 reasons. One, the evidence doesn't suggest at the moment that schools are places that COVID-19 is being transmitted. And secondly, they're open because it's really important that there's a place for everyone to go to learn. And for some people, learning in their home or their household or their foster home or their resi care place just isn't the right place for them to learn. It can be really distracting sometimes, hard to concentrate, or you might need a teacher actually there with you. And if that's the case, it is absolutely fine to continue to hook in and engage at the school site. And that's a discussion that you probably could have in your household to figure out which way is going to be the best way for you.
Such a good answer, and it's a really important one as well because we've been getting quite a lot of questions around that and from carers as well. So just it's very important. Yeah.
Thanks.
Jubes, you've got the next question.
How long's the lockdown going to last?
That's one for me, one for Dr. Scott. Jubilee, that's a great question. I think most of you online and other people watching this in the recording would be wondering how long is it going to last for. It's been going now for around about 3 to 4 weeks, and we do think at this stage we'll need it to go for at least another 3 to 4 weeks. The whole idea about the lockdown is because with coronavirus, we don't have a cure yet, we don't have a vaccine, we don't have any specific treatments. The only way that we can stop it spreading is by making sure that there are there aren't many opportunities that people have to come face to face with each other, because that's the way it's spread from person to person. When they're face to face, and particularly if it's for more than 15 minutes, a period of time, it can pass from one person to another. So the whole idea with the lockdown, by meaning that there are lots of shops where there would be lots of people, are now closed, meaning that you can only go outside for certain reasons, and when you go out, it's only with a maximum of 2 or all the members of your household, and you can't have any more than 2 people over to your place. All those things are trying to make sure that if there's someone with COVID or coronavirus, that they're less likely to come in contact with another person when they could spread it. So it is going to be hard. We were all just talking a little while ago about lots of different things we've been doing when we're at home during the lockdown, and we were talking about art and listening to music. I think it's really good to do all the things that you like to do, and try to learn some new things as well. I know of some friends that are learning different craft activities when they've never done craft or art, or even to learn an instrument or play music. So it's going to be for a bit longer. So I think it's really good to do different things to keep you going. But the really important thing is to stay connected. So we talk about physical distancing, that's keeping away from other people, but it's really important to stay socially connected. So use the various platforms to keep contacting friends and people that help you keep safe. Great question.
Great.
Thank you.
Thanks, Dr. Scott. So, Nicola, you've got question number 6.
What's the best way to contact child safety services if we are in quarantine and don't get to see our worker face to face? I think Sonia already answered that, like, last question, probably.
She did a bit, Nicola. It's good to see you. The thing is that they're still there for you. It's going to be harder, and we've got to change the way we work so that there's less face-to-face and less travel, as I said before. But your work is still there for you, and we need to move to probably working in between you and your worker. What's the best way that you keep up your regular contact? Now, they should be making regular contact with you anyway. But if at any time you want to speak to them and get in touch with them, if there's a number you've got for them, please use it. Text them to set up a time to have a conversation, or just call them directly. And what we might find out of this is that we end up with more regular and better communication, because we're not reliant on the logistics of organising people to be in the same place when it fits in their diaries, but we are able to have more conversations more frequently, get the information that we need, and build that communications relationship that we need between kids and young people in care and their workers. Now, if for whatever reason your worker is unavailable or misses a call, or you can't reach them, please do speak to your carer. Or if you don't want to or can't for whatever reason, you can contact the Child Safety Service directly. That number should be available to you, or you can look it up, or you can call the advice and referral line, as Sonia said earlier on. Identify who you are and just say that you need to speak to somebody because you can't get in touch with your child safety officer. But again, the coronavirus period is going to change how we move around and how we meet, but it's not going to prevent it. And in fact, I've had more meetings today I got into them quicker than I got into this one too, on my phone with people at shorter notice than I normally do, and I didn't have to drive for 4 hours to get to Hobart to have those meetings. And so I think we're going to adjust to this pretty well and pretty quickly. And those of you who are under the age of 40, which is most of you on the panel there, you've got the edge on the rest of us, because you are natives to working in this social media networks. And some of us clunky old people are probably going to have to learn a few tips from you as to how to do it frequently and well. And so please make it work. And again, if you haven't had the contact you need from your worker, you contact them and set up a time, set up a schedule that suits you both, and stay in touch.
Great, excellent answer. So we've got Tara next with question number 7.
Yeah. So if we get no contact from our workers, what will they do if something happens to a child? What alternatives will they offer to support the child?
Thanks, Clara. The expectation is, as Roger was just saying, that children and young people will have contact with their worker. There is opportunity for there to be face-to-face contact for a child and a worker if that is deemed absolutely essential. So there are processes all being put into place in child safety so that there is a process of making a decision and going through the safety checks that, first of all, the person who is doing the visiting is safe to be doing the visiting and has the right safety gear that they might need to do that, and that the people that they are visiting have also gone through a safety checklist to be able to do that face-to-face contact. So child safety is certainly considered to be an essential service for children and young people in Tasmania to keep on going at this time. So where it is deemed essential for that face-to-face contact to happen, it will happen as safely as it can. If it's not essential for that to be face-to-face contact, obviously that can continue through the different means that Minister Gench was just saying. So one of the other things that's worthwhile mentioning to children and young people is that you hopefully have, because this has been sent to all children in care in Tasmania in the last week, and this has got 4 key steps in it that steps through. So a little flip card for those of you who like to fidget, you can just keep flicking it around and around, and it's got 4 steps. So it says if you can't get hold of your worker, try to ask for your worker's boss. That's the team leader in child safety. If the team leader's not available, ask to speak to the child safety manager. Again, they do really want to know if something's not okay for you, and they will be wanting to hear from you. So that number's 1300 737 39. There's also some resources that you can now find on a new web page that's the Child Advocate web page. It's called communities.tas.gov.au/child advocate, and that's where you can find out more details, which again are also in this little flip card, around who you can go to make a complaint. You can actually write to the big boss of child safety. That's the Deputy Secretary, Mandy Clark, and again, she would be really happy to hear from you. And there's also the details of how to contact the Ombudsman. So don't hesitate to reach out to some of those other people if you've not had luck getting through to your actual worker.
Great, thanks, Son. So, Jaren, you've got question number 8.
When will they have a cure for coronavirus?
When will they have a cure? That's a great question, Jaren. There are a lot of scientists around the world working on a cure, and we think the best cure at this stage is probably going to be a vaccine, but it's still going to be quite a long time off. It might be even a year off or more before we have one that's safe to use. But in the meantime, what will be most important that we all do is to keep ourselves healthy and to do things that help prevent us from getting coronavirus or spreading it to others. So I think it's really important till we've got that cure that we make sure we do some really simple things. Really important to wash your hands with water and soap really often, particularly before you leave your house or when you come back from being outside, and particularly before you eat. It's really important to wash your hands with warm water and soap, and to do that for about 20 seconds actually, which a lot of people say is about as long as it takes to sing happy birthday twice. So you can sing happy birthday to yourself.
Nice one, Dr. Scott.
Yeah, good
nice one.
Right. And so that's really important. The other thing that you can do to help, and it's really helpful for any health problem that can spread like coronavirus, is if you cough or you sneeze and there are other people around, make sure you cover up your cough with a tissue, or you can cough into your elbow. If you do cough into a tissue, throw it in the bin afterwards and wash your hands again afterwards as well. So they're things that you can do to stop spread of lots of diseases like flu and coronavirus. That's what you can do until they've got a cure. But I think the other thing that's really important is to look after your overall health. And that's really important during the time ahead, particularly during the lockdown. And that's about your mental health and your well-being, your physical health. So it's really important to make sure that you do get outside for exercise. You're allowed to be outside of your home to exercise as long as it's yourself with one other person or all the members of your household. And that exercise is really important, not just to help keep us healthy, but to be outside on the street, to see other people from a distance, to see the trees, the birds in the air, the clouds, maybe the sunrise or the sunset. All those things are really important for our mental health, and that's going to be just as important as our physical health for the time ahead until we get that cure. And thank you for your question.
Great. Thanks, Dr. Scott. Zara, you've got question number 9.
How long till we can go outside till we can talk to friends and do group activities?
Thanks, Zara. It's a great question, and it follows on really nicely from Dr. Scott's answer. The first answer is you can go outside at the moment, as Dr. Scott just said. You can go outside to get essential supplies or to do some exercise, either on your own or with one other person or in your family group, and that's really important. And you can also undertake group activities, just like we are right now. And I know that I've taken up catching up with a heap of mates of a Friday afternoon on an app called House Party, which is really fun. And it includes games, trivia, and I've become a champion. And I know that lots of young people I know are doing the same thing, and they're also catching up on lots of other online apps like Messenger, Zoom, heaps of them. And Discord is another one that people are using for gaming. So that kind of online social activity is really, really important at the moment. And it was great to hear the Minister talking about funding to help families set themselves up to enable that. It's really important. But I've got some spruiking to do now, because when you're doing this stuff either online or exercising outside or keeping yourselves socially safe during this time is the word that I'm using, socially connected, socially safe. I really want to know about it. So we're running an Instagram campaign. Instagram's another way that people, can stay connected and keep an eye on what one or other are doing. I'm going to try holding this up. Does that work? It's not really working. So it's not really working. So I'm going to read it. The Instagram handle is @child_com_TAS. So that's our handle. That's who we are. And then the hashtags are hashtag safely social or hashtag socially safe. So if you or your carers or other people in the household want to capture images of anything you're doing, from gaming to making bread to walking outside, please capture it, share it on Instagram, hook it in with that handle and those hashtags, and then we can share it to help other people stay connected and socially safe.
Great. Excellent.
Thank you for your question.
Excellent. So I might just whip around just before we go into the next question. Has anyone got any ideas or things that they have been doing, like that's been keeping them occupied or doing something fun?
I've been doing a lot of cooking.
Right?
Yeah.
Awesome. That's great.
I've been socializing with my friends by playing different online games and like connecting by Discord and like playing Minecraft to keep, our friendship group kind of connected and to keep that relationship going. And so, remember that, even though you're isolated, you still have people there for you.
Great.
Yeah.
That's awesome. Yeah.
I've been texting my friends on like the Instagram group chats and like just having conversations daily with them on the group chats.
Great. And
that's awesome.
Anyone else? What have you got?
Occasionally cooking. My artwork I've been working on. That's about sums it up.
Great, excellent. Thanks for sharing, guys. That's really cool. I've been mastering some board games with my partner, and that's been really cool. Like, yeah, just totally like out there. Like we've become full-on tabletop gamers.
Yeah, me too. And we have just rediscovered pickup sticks. So
Oh my God.
I know. It's so incredibly daggy, but it is so competitive. Oh, it gets very full on in our household.
So in my household, we've been playing a board game called Pandemic. Would you believe?
Oh,
Yes,
I'm not at work. I'm still living it.
you can't get enough of it.
I'm sorry, Dr. Scott. That's
I know.
That's sad.
We've always we've been a fan of the game for years.
Yeah, cool. That's great.
I cracked open a jigsaw puzzle. I reckon I've had for about 10 years, and it's 1,000 piece one, and I've been missioning with it. My sons are a bit older, and they one of them who's one's 17, one's 20, and they keep kind of, are you still doing that? And it seems to be a massive time waster. A lot of time passes when you're just looking for a single jigsaw piece.
Yeah, jigsaws are great. Okay, so we'll move on to the next question. So that would be Jubilee. For question 10.
Who can children and young people talk to about the concerns about the virus? Talk to about concerns about the virus. That's the wording.
Thanks, Jube. Yeah, I'll take that one and start it off at least. Having information is really important, and if you're starting to worry or get anxious about this, you need to arm yourself with some information, because the more you know about something, the less you fear it, really, because you know how to deal with it and how to manage yourself, keep yourself safe, and to know what's going on. So there's an enormous amount of information going around. My suggestion would be to start off first with an adult or someone that you trust, someone that you go to who has your best interests at heart, your carer or a family member, or someone else that you know who you trust will be giving you good information or telling you they don't know if they don't know. I think some other good advice is don't get it from Twitter and social media and Facebook. Look out for people like Dr. Scott. Tune into things like the morning press conference that the Premier gives, where he and the Minister for Health, Sarah Courtney, and the Director of Public Health, Mark Veitch, get up and give an update on what's going on. There's also fantastic resources around, like the coronavirus website for Tasmania, coronavirus.tas.gov.au, and that's where all of the latest information gets posted. And I mean, whilst you've enjoyed cooking and music and playing questionable board games, Dr. Scott, you need a hobby, you can spend all your time just researching, and really there is an enormous amount of information available, and the more you know about it, I think the better equipped you are to look after yourself, to know about what you can and cannot do safely, how to look after the other people around you as well, because all of us will know somebody who is either vulnerable or frightened, or who may have some other health condition that makes them needing to be particularly careful. That a friend and a family member, you can be helping them as well. So get onto the hotline, the website, and choose the media and people that you trust to get your messages from, and don't get yourself scared by what some people are putting around on social media, because unless they've got a degree like Dr. Scott's, they're not necessarily a safe source of information.
Great, excellent, thank you. So we've got, I think we're up to question 11, which is Derek.
Yep. What happens when young people turn 18?
Derek, when a young person turns 18 during this time of the pandemic, there's probably two different ways I need to answer that question, which I'll do for young people who are in resi care and for young people who are in family-based care. like kinship or foster care. So for a young person who's in resi care that turns 18 during this time, it would be fair to say that all of the young people would have a leaving care plan or a transition to independence plan. I'm hoping to make sure that that gets changed to just my future plan or something that sounds a little bit more friendly. But it'd be important that that plan is still in place and that you're a part of being able to create that plan and make sure that it still happens. My hope would be that it can still be followed if it's safe to do so. So it would be great if there doesn't need to be any significant changes, that your transition to independence plan proceeds. But if it can't because of issues with the pandemic or it's not safe to do so, then the expectation is that that would be assessed on an individual basis. So each young person's going to have different needs, and there's also going to be different opportunities as well. So they're going to be very individual depending on the different circumstances and the people involved. So the hope is that all of those options would be explored and that each young person is able to be part of that process and that all negotiated on a case-by-case basis. I think it's probably important for people to know that in a situation like this, the department knows it needs to be flexible. There might be some things that have to land differently for young people, and it calls on the grown-ups, I think, to be flexible and to adapt to these situations so that the plan that gets followed through for each young person is what's right for them. So a young person is in family-based care. The options now to stay in that home have obviously progressed in this last year or two. So options to stay at home and your carer receive payments continues with the payments decreasing each year until a young adult now turns 21. So for any young person whose transition to independence plan was that they would have been staying home anyway, the expectation would probably be that would still, again, that plan would keep going as per normal. There wouldn't need to be any significant changes. If there was a plan for that young person to move out and live out elsewhere, hopefully that plan could still happen. But if that plan needs to change because of the COVID-19 situation, again, we would want to see that that's worked out on an individual basis for each young person. Yeah.
Great, that's a great answer, Son. Thank you. Because I think there'll be quite a few young people out there sort of transitioning to independence, sort of thinking about that at the moment. So it's really nice to have that that reassurance that they're going to be okay. So yeah, so thanks.
It's really interesting. Sorry, I'll just keep on going. Holler out and wave at me if I should stop waffling on. But I think when talking this through in the last couple of days to make sure that we could give some clear information, we were thinking of different scenarios. What if a young person actually needed to stay on in their residential care home and that service provider was willing to negotiate with the department? Wouldn't that be great if, even though they were 18 and they were now an adult, they've got different rights, different obligations now? And so wouldn't it be great though if it was safest for them to stay put, that they didn't have to move out? I would want to see that for that individual, the department and that care provider might be able to come to some arrangement during this period of this pandemic, which we don't know how long that would go for. It might be that that young person needs to agree to probably forego some of their young adult rights. They might still have to agree to be following the same rules of the household as if they were still 17, something like that. So that's what I mean about that negotiating on each individual circumstances, what their individual needs are. So yeah, that's a bit of an example. Hopefully everyone can be flexible and kind.
Great, thanks, Son. So the next question, I was wondering, Judes, do you mind asking this next question? Because Zara's just dropped out, so number 12.
What kind of symptoms do you have if you get coronavirus?
Yeah, the symptoms of coronavirus can be a bit like getting the flu or a really bad head cold. So you can get a fever. What a fever is, it's that feeling like you're either really hot or really cold, even though the room temperature is really comfortable. You might get goosebumps all over you and feel really shaky. That's what a fever is. You might get other symptoms that might be like a cough, a sore throat, a runny nose, or even difficulty breathing. Now, those symptoms are pretty common with head colds and the flu. And most people in Tasmania at the moment, if they get those symptoms, they're not likely to have coronavirus unless you live up in the northwestern region, up in the northwestern. So that's the area from Latrobe and Devonport, right across to Smithton and down to Queenstown and Strawn. So people that live in that area are a bit more likely, if they have symptoms, they could have coronavirus. But it's really important, if you get any of these symptoms and you live anywhere in Tasmania, at the moment it is important to get medical care, to see a GP, and it'd be best to discuss that with your carer or your child support worker. You can call your GP, and most GPs now are doing telehealth, which means it's just like what we're doing now, but they do a health consultation. And they can even organise for you to have a test if they think you need testing for coronavirus. The other thing you can do is you can call the public health hotline. Now that number's 1800 671 738. And there are people on that line, including nurses, that can talk with you about your symptoms and talk with you about where you live and where you've been and work out whether you might need testing or not. So you can call your GP, or you can call the public health hotline on 1800 671 738. But it is really important to understand, even though there's a lot of really worrying news at the moment around coronavirus, most people that get coronavirus only get quite mild disease. They don't get very, very sick. About 80 to 90% of people, that's if you had 10 people that got coronavirus, 8 or 9 of them wouldn't get really sick. So most people do very well and recover, but if anyone does have coronavirus or think they could have coronavirus, it is really important that they be assessed for testing. Your GP or call the public health hotline. Thanks for your question.
Great. So we'll move on to question 13. So that's Tara.
What will happen to kids if a carer has to go to hospital because of the virus?
Thanks, Tara. The good news is, as Dr. Scott just said, that most people who do get the virus have relatively mild symptoms of it. And for a lot of those people, the doctors will be able to supervise them to get better at home. And so, as far as I understand the information, if you live with someone who, your carer or those in your household, and someone there contracts the virus and is diagnosed and is being supervised, they'll be getting better at home, and you'll probably be stuck there with them for a while until they're better. So that means nothing changes, except that you become part of the quarantine, and other people bring you your shopping and things like that to look after you. So in the case that someone who's caring for you does need to go to hospital or to somewhere else to be supervised while they recover, because they need a bit of extra care and attention, the arrangements will be in place to look after you where you live with another carer, if that can be worked out, so that you maintain continuity of staying at your home, or if needed, with somebody else who is a carer who is familiar to you. So the most important thing to all of us is that you continue to have care from someone that you know and trust to look after you while your main carer is being treated or taken care of away from the home where you live right now. But again, in most cases, it won't be that someone goes away to hospital, as I understand it, and that if someone in your household has the virus, then you'll be part of quarantine with them and staying at home. So thank you for your question.
It would be fair to say as well that it's a really good point in time to actually start having these conversations in your home with the adults who care for you, and maybe your child safety worker as well. What is the potential backup plan? Probably one of the best things to give us peace of mind when we do have this kind of uncertainty, to try and think, well, where can be those points of certainty for us? What will be the plan? And whilst it's relatively calm in comparison to what it might feel like if someone in your home got sick, good to have these conversations now. Ask those questions about, who would I like to be able to care for me if my carer did have to go to hospital? If that was able to then be that person to step in, great. Depending on the situation, it might not be able to happen, but be able to have the conversations now and create that backup plan now might help to give a bit of peace of mind at this time. Yeah.
Great, that's excellent. So Jaren has dropped off, so Nicola's going to ask the last question, which is question 14.
What resources are available for children and young people to find out about the virus?
I'd just like to point out my background before I answer the question. This is a photo of the street that I live on, and all the children and young people in the street, and actually some of the adults too, have all been taking turns writing things on this really daggy concrete wall. Just messages of hope and kindness. It's really lovely.
I reckon you might have started that.
We have now run out of
misspent use.
So in terms of resources, Nicola, one of the best resources I've seen so far was actually the one that the Create Foundation have just recently put up online, which is a fantastic cartoon about the coronavirus, or lots of little cartoons, and they're available on the Create website and also on the Facebook page. The thing that I really like about them is they're so simple and accessible, and in a language that everybody can understand and relate to, and they're also really cute. Other resources, I'm echoing a lot of what the Minister said a couple of questions back. The most important places for you to get your resources and information are the trusted, fact-based resources. So the Create Foundation will have fantastic resources. It might be that some of your workers or the people who are caring for you give you some resources that are backed by really good organisations that have been providing them to people who care for children. And there's also the fantastic coronavirus website that the government have put up. I'm going to try this again. No, it's not working. It is coronavirus.tas.gov.au. And there's information on there about everything from what's open and what's not open, to how gatherings can work, to the facts about coronavirus. The other place that you can get information is my website. We've created a new section of the Commissioner for Children and Young People's website in Tasmania, and our address is www.childcom with 2 M's .tas.gov.au, and we've created a new area of our page which is just about coronavirus. It includes a huge range of questions and answers for young people, as well as lots of other resources and information. So they're 3 places I would recommend that you go: the Create resources, the Tasmanian Government web page, and I'll just say it again, it is coronavirus.tas.gov.au, and also my page, the Commissioner for Children's page, which is childcom.tas.gov.au.
Great, thanks, Leanne. I'll hold this one up. So this is the There we go. This is your questions answered. So these were questions that were coming through from young people. So there's 3 pages to that one. And you can find that on the community's website as well as the Create website as well. So these are sort of aimed at 12 and above. But as Leanne said before, the animations for the 12 and unders are really cool, but they're great for everyone. They're really cute. So we're releasing a few different ones every week, I think it is. So, but I'll obviously keep it out there, and it'll be on all social media. So,
Terrific.
That's very cool.
Yeah, thanks, Danny. I just want to say a quick thank you to you and all of the young people here for your fabulous advocacy and also for your terrific questions. These will be really handy as we continue this journey with young people around Tasmania. So well done.
Great.
And thank you for asking the questions that other people might want to know the answers for as well, who will be able to view this. And thanks to you having asked the questions, they'll get to hear information that they might need. So thanks again for your leadership in doing that on behalf of young people in care.
Great, thank you. And thanks to our panelists for taking the time to come and answer the questions, because we know that that you guys are very busy at the moment, and so we really appreciate it. And it's such a great thing for you to be able to do. So thank you.